The start of a new year typically means the start of new resolutions, and for many, it's about health and wellbeing and cutting back on alcohol consumption. Caterina Giorgi, the CEO of the Foundation for Alcohol Research and Education, joins me now. Good afternoon.
Good afternoon.
Caterina, we're a social nation, aren't we? Is this something we need to address most years?
Well, alcohol causes so much harm across the community. And what we've seen with COVID is that there's increased pressure on people, and some people are turning to alcohol to deal with that stress and anxiety. So the New Year's is a good opportunity to reflect on your behaviour and see if there are some things that you can change to help to improve your health.
So what are some of the benefits of cutting back from alcohol?
Well, the great thing is that there are some things that people will feel immediately. So people will have better sleep, their mood will be improved, they'll have more energy. And in the longer term, reducing alcohol use reduces the chance of people getting chronic diseases like a range of different cancers, and also alcohol use disorder, and also reduces the chance of it contributing to anxiety and depression and other mental health conditions.
So where do you even start? Because I feel like in January every year we always say to ourselves, okay, we're going to get a bit healthier, we're going to cut back on this, cut back on that. Where is the best place to start?
Well, the best place to start is to set a goal. So it's really important that people are clear on what they're trying to achieve and setting limits for themselves. And then it's important to understand what a standard drink is, because often a standard drink is much less than what people think. And then to help to stick to that goal, it's great to have a network of people around you who are aware of what you're trying to do and are there to provide a supportive community to allow you to be able to do that.
And it feels like to me, previously when I've done things like Parch March and Dry July, it's really the habit of having a drink with you in a social setting. But these days, there are so many other options on the market. If you really do want to have what appears to be a glass of wine or a beer or something, there are so many options now as well.
Yeah, look, and there are also so many different ways to socialise as well now, which is great. And we're living in a completely different environment and different world. What we're seeing is lots of young people who are choosing to reduce their drinking or cut back their drinking or not drinking at all. We used to look to that group to be the most social group. So if they're still being social, if they're still engaging and they're reducing their alcohol use, then there's something that we can all learn from that.
Yeah, you're right. Perhaps we did take a lot from COVID in the sense of that, your health and your well-being is so important, and getting out and being active and not sitting inside and perhaps being a little bit more antisocial is really for the best, not to mention you feel so much better when you're not consuming alcohol.
Absolutely. And often because it becomes a habit, people turn to alcohol to give them things that it actually doesn't deliver. So if you want to relieve stress, if you want to feel better, if you want to reduce anxiety, then things like going for a walk, catching up with a friend, eating a healthy diet, all of those things, getting better sleep are far better for your health and well-being. And alcohol actually contributes to worsening so many of those things. It makes your sleep worse, it makes you more anxious. And so we just need to try and use this time as an opportunity to have a look at this and to change it as well.
So if you feel like perhaps you've been drinking more than you should, or you're concerned about a particular pattern forming, that you're relying on alcohol more than you should be, what services are there? What support is there?
It's great to see that there are so many online services, there are phone services, and there are also face-to-face services as well. So people can call the Alcohol and Other Drug Hotline on 1-800-250-015, or they can see a range of services at our website at www.fare.org.au.